Hello and welcome to another live stream with the House of Medics. You probably haven't seen me online live with the House of Medics for a little while, but for those of you who don't know me, my name is Dr. Emma. I'm a dermatologist and the founder of the House of Medics, and I have with me...
My name is Gyasi. I'm one of the junior doctors here in the UK, yeah?
Awesome. So He's acting very humble, but actually he's done a lot of amazing work. So we're going to be talking about today how to make that transition from studying medicine abroad and actually working in the UK, which John has done successfully, or Dr. John, I should say, has done successfully, and he's helped lots of other people do as well. So we can see all your comments. Make sure that you write a comment so that we can shout you out. And if you have any questions throughout the day, make sure you type them in the chat. We can see everything, and Dr. John will be answering them live. But first of all, just tell us a bit about yourself.
Okay, so like I mentioned, my name is Gyasi Apia. I'm one of the junior doctors working here in the UK, and I've been working in the UK for almost close to a year now after finishing medical school about 5 years ago, So that's basically a bit about myself now,
Great. So tell us about the journey. Like, obviously, becoming a doctor is not easy in any country. So tell us a bit about your personal journey and how you got to where you are today.
Yeah, so I mean, medical school has not been easy. I finished medical school in 2019, from Kwame Nkrumah University of Science and Technology, Kumasi, Ghana. So after finishing, I went on to start my house job at Komfanochi Teaching Hospital for my first year house job, and also moved to a district hospital to do my second year housemanship. Upon completion, that's when I started with my UK medical journey to get my license to practice here in the UK. So while I was working as a medical officer in a district hospital in Ghana, I started preparing for my medical exams here in the UK. That's basically the PLAB exams. So I successfully passed it almost a year ago, more than a year ago, and I started working in the UK close to a year now, So that's basically how my journey has been. Amazing. It's been a journey which has been worthwhile so far, but I think there's more to come in this journey,
For sure, definitely. Somebody's called Reginald says, AJ, one cheers. So, hi, Reginald. Thank you for sending in a comment. Please make sure you send in your comments. They really do encourage us. And like I said, if you have any questions, pop them in the chat. Someone said, Rachel says, whoa, fire emoji, fire emoji, fire emoji. Yes, we like the fire emojis. Keep sending in your comments. We can see all of them. So just a few things that you touched on. You touched on studying medicine in Ghana. You touched on your housemanship jobs. Tell me, what is it like actually studying medicine in Ghana? Because I never worked in Ghana, but I did work experience in Ghana. And the students, it looked hardcore. Like being a medical student here in the UK, you have a certain degree of work-life balance. People can be a bit mean to you, but not that bad. But when I was doing placements in Ghana, I actually saw that it looked very intense. So tell me from your perspective what it was like. Okay,
well, medicine in Ghana is challenging like in any other country, because I mean, getting into medical schools is actually the challenging part. Because for us in Ghana, it involves like passing the exams, the entrance exams in most medical schools, which is very difficult. I mean, you don't get to even finish, but sometimes you are done and you're just hoping that you are called for an interview, because in the interview you're just hoping you're able to impress your examiners who are interviewing you just to get a place or a slot in medical school. But medical school, I mean, with a lot of exams are on end, and you're writing exams almost every time. So it means you have to be learning almost every other time. You have to have a schedule to follow. And it's challenging, especially when it gets to the clinical years. That's where you have to apply yourself on the wards. And that's where your examiners or your consultants are getting to see you on the wards. And you really have to show that all that you've been taught in class, you are applying it. And that's what will really tell when your final exams comes out. I mean, graduating in final year of medical is one of the best feelings. I mean, when I graduated in 2019, waiting for the results to come was one of the best feelings ever. Like, waiting for them to post their results. And everyone was so eager. It was very nice to see myself and some of my friends, most of my friends, that I was learning with my group members, and virtually everyone in my class, like, just to see us pass the final medical school and actually become doctors. So it was very challenging, but the journey was enjoyable. I actually enjoyed medical school. Let me say that. I mean, I'm not going to lie. I enjoyed medical school, and it was more of like having a work life, a balanced having a balance between working in the ward and also having life outside of the wards, because it's not easy. You might turn up to be so much engrossed in books that you might be missing some things which are very important outside of the classroom. Yeah, so I would say medical school is okay.
Yeah, I 100% agree. I always say that I miss medical school, and people are like, "Why do you miss it?" And I just like, it's just it's a very interesting time to just be so engulfed in studying. You meet some of your most amazing friends. You learn so many different things. You're away from home. So I always say the same. Like I did love my medical school experience. Now let's talk about the housemanship jobs that you touched on. Maybe not everybody watching knows what that means. So maybe if you can explain a bit about what it means to be a houseman and a bit about your experience. We're getting more fire emojis. Please, if you like what Dr. John is saying, be sending the fire emojis so that he can be encouraged, and we'll keep going.
Okay, so I mean, once you finish medical school, there is a mandatory 2-year housemanship, more like an internship. Over here in the UK, it's more like the foundation program. So in Ghana, you have to complete your 2-year housemanship period. You mostly do one in a teaching hospital, and the second year is mostly done in a district hospital where you get to see variety of cases that you might not get to see in the teaching hospital. And doing house job is actually when you get to see yourself as being a doctor, and that transition from being in final year medical school to a first year house job is a whole different thing. Like it can come as a shock because now patients' life are actually entrusted to you, and you have to make decisions. And at a point you're like, is this what we're learning in school? Like, are we supposed to? So I mean, it's people adapt to it differently. But for me, it was a bit challenging in the initial part. But my residents that I was under them, they really helped me to settle in. I started with internal medicine, so it was like getting to see cases, discuss with them, and I felt that house job really formed the foundation of you being a doctor because you're actually learning medicine right from the start. So it's important you get the fundamentals right so that you can build on it in the future. So I just told myself I just had to apply myself and put in the effort. And then at the end of 2 years, you look back and I think after house job, you can really decide, I'm not going into this field. I'm not going to do this. But I really like this department. I would like to work with them in the future. So house job gives you the opportunity to really practice as a doctor, and then you get to decide where you want to really specialize in. So for me, I think I enjoyed house jobs. So let me say it that way. I mean, in CATH, I did my 2 rotations there, medicine and obstetrics and gynecology. That's like women's health. I did that. And then I went to the district to do child health and then surgery rotations there. So my 2 years were spent in those 2 hospitals. That's basically how my house job experience has been. Yeah.
Amazing. Yeah. I heard that you work 7 days a week in
yeah.
How does that work?
I mean, house job in Ghana can be very stressful. Yeah. Sometimes some rotations will cause you to do the whole night, and the following day you have to review your patients in the morning before you leave. Some rotations can be very intense. Some can be a bit relaxing. So sometimes you get to get a balance of go through a very intense rotation, and sometimes some rotations are very relaxed. You get that to also do some things outside of work, because it's not always about work every time, but you have to be at work. You have to be present to see your patient and ensure that they are getting well. And that's the main thing about being a doctor, ensuring that your patients come with their concerns, you are addressing it, they get better, and then you take it from there. So it can be very busy, because I remember some of my rotation, I was closing so late. I get home, I don't even remember how I get to sleep. You have to wake up in the morning and come and not be late, because ward rounds, your consultants are waiting for you. Crazy. So it can be very challenging, and it actually teaches you an aspect of life that you will see it in a whole different way, like managing your time, getting things done outside of lectures, outside of the ward environment, and also being present every time. Yeah. So you can actually be very busy. Yeah.
Yeah, I think you've raised a really interesting point there, because a lot of medics forget that they have so many transferable skills that you gain from just constantly being under pressure, constantly having to be excellent, having to learn. So like you said, time management skills, being mature, communication, so many skills that different medics have. I think there's a few comments coming in. Somebody said medical school was easy for John. Was easy for, is he that guy? Is that guy that didn't have to revise? The genius of the class. I wasn't that person. I had to study. House job is also labour time for junior doctors, but really interesting. And I think that a lot of people say that, and it's really great. I think from my experience, from speaking to people who have done house jobs in Ghana, the pathology you get is so interesting that often I hear people say, you know, they don't even mind that they're working such long hours because it's just so interesting. Whereas here in the UK, I think the service provision can get people down. It sounds like it's a really great experience. The fire emojis are still coming. Yes, guys, we send in them because it's making us happy. Someone said, yes, he was that guy. I knew it. And you know, I'm happy you said it because even me, I felt like I knew it in my spirit. So it's good that you said it and we can agree there. So I obviously have some inside information. I know you want to be a dermatologist. Obviously, that's the best specialty. Not being biased, but obviously dermatology is fantastic. Tell us how you ended up deciding to go for dermatology.
Well, when I started working in the UK, I always wanted to do internal medicine. So I applied in the national offer that started last year in November, and I was shortlisted for the interview. So I successfully passed the interview and I got an offer to start the internal medicine training. So I think thinking about the decision to enter dermatology, I thought it was more of like deciding on the career, where how I want to spend my life after finishing training, and then also the work-life balance that comes to being a dermatologist. And also I think when I was in medical school, when I enjoyed house job too, some dermatology cases that I got, we didn't really get a lot of dermatology exposure when I was in medical school, and then during house job, I didn't really get to do dermatology rotation. But I think working as a medical officer in a district hospital, I was exposed to certain dermatological conditions that I felt, I mean, if I got the opportunity, whether in the pediatric department or in the internal medicine, which is the adult group, I would like to specialize in it and then get to see how it is. I mean, I'm about starting internal medicine training now, so I'm looking forward to how the training will be and get exposed to how dermatology will be, and then I think it should be something I should confirm soon.
I love it. And I think Dr. John said something very key that I would say, if there are any medical students or junior doctors watching, when people ask me how to choose a specialty, I always say look at the consultants, don't look at the registrars, because registrar training goes super quick. So personally, I'm pretty much done. I'm going to be done with my registrar training in August. And I think that it's very tempting to look at those who are immediately senior to you when making your decision. Be like, oh, that person looks happy. Maybe I want to be like them. But really, the registrar and the junior doctor training is so quick. But when you're a consultant, you're going to be a consultant for 30, 40 years. So definitely look at the consultants, look at the lifestyle. Don't just choose based on the medicine. You do need to think about, you know, what is your life going to look like when you're 40, 50 years old and you're doing a specialty. Are you still going to be happy with doing night shifts? And is the love for the specialty going to be enough to carry you through, especially in the NHS, because it is difficult. So I think you really raised some really interesting and worthwhile points there. Let me go back to the comments. We have more people confirming that you are that guy. Fantastic. If you also agree, please send that in. Someone said, I almost gave up on the medical profession during house jobs because it was mental and physical torture. I'm so sorry to hear that. I'm really sorry that you went through torture. But it sounds like you didn't give up, which is excellent. Feel free to comment again to tell us like what you're up to now. And I'll be really happy to hear that you made it through. Nanayal said, if you have your house job done in Ghana, forget. You can work everywhere in the world. And I feel like that is what everyone says when I speak to them. It makes you extremely resilient, extremely knowledgeable. So definitely. Someone said, so how did you build your portfolio for internal medicine? We're going to come to that in a second. And someone else said, congratulations. I don't know if that's to me or if that's to Dr. John, but we can both have it. We can share it. So yeah, actually, let's get into it. So the person has asked, how did you build your portfolio? Actually, before we do that, let's talk about how you passed the exam. So before you could even get into internal medicine, how did you make that transition as someone who studied medicine in Ghana to pass the PLAB? So maybe explain to everyone what is involved in passing PLAB. I know it's very difficult because my husband has done the same. And maybe talk us through your journey with the exams before we even get into internal medicine.
Oh, okay. I mean, so the PLAB exams is the official licensing exam for all international medical graduates who would like to practice here in the UK. I mean, I think it was during my second year of house job when I made a decision to get a license to practice in the UK. It wasn't my intention to leave Ghana to come and practice here in the UK, but I think when I was in fifth year, we went for an exchange program in Germany. So I did an internship in the University of Cologne Hospital where I did an attachment in their trauma and orthopedics department. So when we came back, I think I discussed with some of my roommates in medical school. I just decided that we're going to leave after medical school to try and see how medicine is on the outside. But I think it died down in final year medical school because we had to finish and pass the exams before we could think about it. Yeah. So I think after medical school, when we started house job, my roommate and I, we came back to it. We were like, should we go to Germany or something? Like, let's start finding out about the process in getting to Germany. And I'm a kind of person that, I mean, most people know me. I like to find the right information, and I ensure that I get the right information because mostly people will want to know things from me. So I found out about it and I realized I had to learn the German language and then pass the exams. And I told my roommate, I'm not going to do that because I can't learn the German language. So he should take that path. And I think he did it, and he's currently practicing there in Germany now.
Oh wow! Okay.
So yeah, so after that I told him,
to you,
yeah, my roommate in medical school, yeah, Roland. So I was like, okay, that's cool. I researched and found out from some of my colleagues that some were doing the PLAB exam. So I just asked them like, what's it about? And they told me, and I went to do my research about it, and I realized, oh, it's also an opportunity for me to get license to practice outside of Ghana. So I started practicing for it, or learning or preparing for it. So to write the PLAB exams, you need to have your proof of proficiency in English before you can book the exams. So basically, you need to either write the IELTS or OET. So the IELTS is basically the English standard exams that anybody can write it if it's mostly required for certain job applications. And then the OET is more like, it's confined to the medical field, occupational English test, which in the exams looks like you're more like doing a medical exam, a medical English exams. So you can use either of them as a requisite to show that this is your evidence of English proficiency. Okay. Then you book the PLAB 1 exams.
And let me ask you, do you advise people to go for one over another, or do you think that either way is fine?
Okay, well, as someone who has been exposed to the IELTS, I particularly did the IELTS, and I know some of my colleagues too who did the OET. Sometimes the IELTS can be a bit dodgy and can be very difficult for some medical colleagues to pass it. But because the OET is more medically oriented, most doctors are able to ace it and get it done. And I always tell people, I mean, just choose what you are comfortable with.
Fine.
Yeah, so that's the main distinction between the two English exams. Okay. Then I booked for my PLAB exam with some of my classmates. So I think I had a couple of my classmates who were also on the same journey. We created a WhatsApp group, and then we're learning together. We did the PLAB 1 exam, which can be taken anywhere, all over the world. So after passing PLAB 1, you now have to go to the final part of your PLAB journey, which is coming to the UK here to write the PLAB 2 exams.
Okay, so just so it's clear, so that if anyone is watching and wants to know, there are 2 exams involved in PLAB.
2 exams, meaning PLAB 1.
So PLAB 1, you can sit in your country, any country. But PLAB 2, you need to come to the UK.
UK, in Manchester only.
Before I ask you follow-up questions, let's go to comments. I think Kwabuna said the congratulations was for me. Thank you. And then Michaela says, my people here, thanks family, send in your questions. So for those of you who don't know, Michaela runs House of Medics Ghana.
Oh, that's nice.
So if you're in Ghana and you want to get involved in House of Medics, make sure you send her a message. Okay. And then someone else says, AJ, more fire emojis. Excellent. Okay, carry on. So you booked your exam, then tell me, how did you prepare? Yeah,
so for the PLAB exams, because it's more like a clinical, like an objective structured clinical examination where you are in front of a patient who is also a simulator, then you are given a clinical scenario, you'll be managing it. And because it's more in the UK setting, and
this is PLAB 2.
Yeah, PLAB 2 exams. Yeah. So the way the UK medical scene is way different from how we practice in Ghana. I think there's a bit of difference. So you have to really practice certain scenarios with most of your colleagues to get adapted to how the UK medical practice is like. So we formed groups, and then we're practicing most of the scenarios among ourselves just to prepare. And then we made a journey. We flew over to Manchester. It's only written here it's all over. There was only Manchester that you can write the PLAB to. So we came over and then wrote the exams. I mean, the clinical exams is a very intense exams because you have to be on top of your game almost every time because you are going through 16 stations at a go, and you need a minimum of like 10 stations. You have to pass a minimum of at least 10 and get an acceptable score for that day to pass the exams. And sometimes I mean, whilst we were practicing, most of my friends that I used to practice with were like, we had really decided that we needed to get this done. So we put in the effort to ensure that we're passing the PLAB once and for all. Because sometimes, like I said, most getting information becomes very vital. The pass rate for PLAB is around 60 something %. So that means that not a lot of people are really passing it. So sometimes you get to hear people are just passing and you think everybody's just passing, but you have to really put in the effort for yourself to ensure that you are passing it. So I think it was about a year ago, then we came over to the UK in Manchester, then we got our PLAB 2 exams done. The results came and it was a good feeling to that I'd passed the exams, and that means that my journey to getting my GMC license was almost over. Yeah, I was almost done with it. And then there were some few paperworks and then that was it. Yeah. I got the email that I'm on the UK medical register and then that was it. Yeah.
Amazing. Yeah. Okay, so I feel like a lot of people alluded to this, that you are that guy. So you're making it sound very simple, like, oh, you just sat the exam. Yeah. Let us know, how did you prepare? Because I know you said that you formed a WhatsApp group, but had anyone in that group done it before? How did you know what you were doing? Okay, so
basically for PLAB 1, at the time I was preparing, there weren't a lot of people that we knew that had done it. So it was more like trying to find out how things were working. But for PLAB 1 especially, which is just a multiple choice questions of just 180 questions. So you have to do question banks to familiarize yourself with almost all the systems. So you need to be doing mock questions to ensure.
So where do you get the question banks from?
There are certain apps available that you subscribe to their question banks, which are available that people are able to subscribe to. And depending on the period, depending on how far away or how close your exams is, there are 3 monthly, 5 monthly, or 10 monthly subscription that you do. Then it keeps you. The question banks really help because it helps in targeted learning, because it's difficult. You'll be doing house job or you are working and you have to come home and later in the evening you have to learn. So the question bank actually helps you have a targeted point of learning things that are really relevant to the exams and also building your content. So that's for the PLAB 1. So it's mainly about the question banks. And sometimes we have group sessions where we discuss some concepts which are a bit tricky. And sometimes these group sessions are very essential because there are some concepts that during the exams, you remember that I can remember a colleague of mine said it during the group studies, and that can help me to answer the questions.
Yeah.
And the journey is difficult, so I personally don't feel that you should do it alone. It's better to go as a group because as a group, you can go further than you trying to go alone, and it can actually help you to release stress because you doing it alone can be very difficult. So that's basically for the PLAB 1. But for the PLAB 2, it's all about practicals, like group sessions, organizing it, and then learning, practicing scenarios over in the evening, having group sessions or like on Google Meet or WhatsApp platforms and having the sessions, getting feedback from colleagues who have done it before. Then they tell you how the exams is and then you're able to build on it from there. Yeah. So that's mainly how to prepare for the exams. Yeah.
Incredible. Okay. Someone said AJ is the Moses of our time, senior man. Wow. How do you get people to love you as much as these people love you? Okay, awesome. So someone has also said, brains, fun, charisma, full package, the AJ guy. Wow. This is really nice, guys. Thank you all for joining and for sending Dr. John all the love. It's really, really encouraging. So someone has asked, what is House of Medics about? I'm going to answer that.
Good, yeah.
And then we're going to go to a quick break. And after the break, we're going to answer the question about how you built up your portfolio, what it was like starting working in the UK.
Yeah.
So in terms of what the House of Medics is about, we are a community of healthcare professionals from all different backgrounds. So not just doctors, it's nurses, dentists, physiotherapists, occupational therapists, anything involved in healthcare. And what we do is we provide the platform for people to network, the platform for people to come and to speak about what they do, what they're passionate about, their experiences. We also do a lot of mentorship and outreach in Ghana as well. So you can, to be honest, this is just a very, very brief, I've barely scratched the surface. We're involved in so many different things. So you can head to our website, www.houseofmedics.org, to learn more about what you do. We're on all social media platforms as well. So send in your AJ made our journeys a success. Big ups, homie. I love that so much. We're going to talk about your community as well. We're going to talk about how you built up your community, how you built your portfolio, and what it's like working in the UK. So please send in your questions and we'll be back in literally 1 minute.
Okay.
Professionalism that draws closer to home. The fundamentals are overlooked, and still, some dedicate their lives so that others can see another day, having a heart to save one. Behind these lives are professionals doing what they love. It's in whom you trust. Systematic geniuses that can't brush their work under the rug to save you and I. A paramedic in an ambulance, a pharmacist at work, a surgeon in the operating theatre, students chatting, someone taking a breather to save a life that puts a smile on someone else's face. Time's ticking. Preparation took our lives to save one. Studied our whole lives to embrace one. Our hearts are uniform before we could even wear them. Our focus means we're the 12th man to assist the injured. A squad, a league of legends. We are necessary. We are not artists, but our attention to detail is key. We are not teachers, yet we equally care for students. We are not mechanics, yet we have to make sure there's enough oil in the tank to keep an individual healthy. We are not your bosses, but we let you know if you're well enough to work. We are medics, a house of love, curators of indispensable knowledge, innovators, the masters of arts. We are counted on, and that responsibility we hold with dignity.
Welcome back. I hope you enjoyed that quick advert. That was an advert showcasing our scrubs line. Again, I didn't mention that because we do so many different things. It's difficult for me to mention all of it. But yeah, we do have our own scrubs line for all healthcare professionals. So that advert was just showing that off and showing off a few different members of the family. The people in the advert are actually all medics. That was me in my dermatology surgery room, so it's all very authentic. So thank you all. I hope you enjoyed the video. I love the comments so much. Someone said, John has always been the guy right there from primary school, Our Ladies of Apostles. So big up Our Lady of Apostles. Someone said, before AJ, people were writing and failing. Those who were passing were also hiding their success pathways, but AJ made it possible for all of us. And I love that so much because that very much resonates with what House of Medics is about, sending down that ladder, being successful and helping someone else to do the same. So I'm super proud of you as well, just for all the amazing work you've done. Someone said, if not for AJ, we would have rotted in Ghana. Oh, don't rot. Somebody said they would have rotted, but yeah, no, it's amazing. I absolutely love your community. So thank you all for joining this evening and supporting AJ. So let's get into it. Someone asked, how did you build up your portfolio for internal medicine training? So please answer the question.
So I mean, getting into internal medicine training here in the UK is very competitive. So when I got here in the UK, it was my long-term goal was always to enter into training. So I was like, I would want to work for some time, get used to the UK medical practice, and then try and get into training as soon as possible. So I got in touch with a colleague of mine who has already started internal medicine training, just to get guidance on how I can go about the whole process, even about some 3 or 4 months before the application process was opened. So he took me through the steps about getting your portfolio, because at a point in time I heard about building portfolio and it felt like a big deal. I was like, I just came into the UK. How am I going to build a portfolio and all of that? And I realized, and he really reassured me, took me through the steps, and I figured, this is something I could get in, because if the portfolio is about being shortlisted and then performing well in the interview, it has to be more of like having self-belief that you can really do what you really want to do again.
And sorry, let me interrupt you actually, because I just realized a lot of people might not know what this portfolio involves. So just to be clear, when we say portfolio, it's a physical portfolio that ends up, usually it's about this thick. My one is upstairs somewhere, and you literally have to list all your achievements from the beginning of medical school up until the time of application. So that might span maybe 10 years. And you have to put in all your certificates, teaching feedback, extra degrees, certificates from courses you've attended. It ends up being such a difficult thing to put together. It's basically your life, your whole career, from however old you were when you started med school, 18 or whatever, up until your adult life. And it is really a big undertaking. It's not an easy thing to put together at all. So just a bit of context. Sorry, carry on.
So I just planned that just to get ready for the application period, I had to ensure I was getting my portfolio ready. So like my audit or quality improvement project I had done when I was in Ghana. And then whilst working here in the UK too, the quality improvement project I'd also been involved in. So I just realized that I had to talk to some of my consultants or my my specialists back in Ghana, just to find out from them how the training was going to be like, and also talk to consultants here in the UK and get to see how to get those portfolios ready. Because once in this current application period, the portfolio was mainly for to help you get shortlisted, and even during interview you'll be asked about what you've really done. So that's why it becomes very important that even when you're in medical school or doing house job and all of that, it's important you do things outside of the main house job you are doing, because leadership counts, leadership positions that you are going to get involved in. Sometimes people are involved in charity projects and all of that. All this counts because you are putting yourself in voluntary service outside of your field, which really counts in such application process. Also, like I mentioned, any audit or quality improvement project that you've done. I mean, doing audits is basically geared towards patient safety. So anything you are doing which is geared in the long term to improve patient safety and quality outcome will be classified as an audit. But you just need to go to the right website, which is the internal medicine training website, where they list the actual things that you need and the scores that you are going to get for each of them. And then apart from that, your clinical experience that you've had over your span of practice, if you've been involved in any particular case scenario that was very interesting that you've published, or if you have any research publication and all of that, you're able to include all of that in your portfolio. And the portfolio, there's a shortlisting score, and the main thing about it is that most people don't apply for this because they feel they will not be shortlisted. But I think you don't need to get a 40/40 to be shortlisted for the interview, because what really will count is, even if you have very high portfolio, you need to really perform well at the interview session, where you'll be after the shortlisting score, people will be called for the interview, and that's where you'll be given clinical scenarios, ethical scenarios, and you'll be asked about your whole clinical practice, which you've already included in your portfolio. So it's basically building your portfolio is like getting a record of everything that you've been involved in, not just medically related, leadership positions, audits, any teaching that you've done. Maybe whilst you are doing house job, you taught medical students, you taught physician assistants, you were involved in such teachings and all of that. All this counts as evidence because it's needed in your overall training to become a consultant here in the UK. So it really counts. So once the portfolio, you are shortlisted, and that's where you have to perform well at the interview on a video session where you are asked clinical scenarios. You have to manage it, hand over to your registrar, your consultant, how to manage ethical scenarios, and you tell them why you want to be an internal medicine trainee. So basically, once you prepare for this, getting feedback from people already in the journey, it makes it easy. And that's how I feel it should be, because I don't think the journey should be difficult for other people to come in. I personally, I always tell some of my friends that sometimes it will be difficult for me to like miss a particular thing away, because I would ask before I go on. Like I'll ask, how is it like? Teach me how it looks like. So it makes it easy for everybody to also follow the same steps, and everybody advances in their career. Yeah, basically that's it.
I love that. And just to piggyback off of what you said, when you apply for even registrar jobs, it's the same portfolio. The same thing, so it's worth putting in the effort the first time and getting your portfolio really organized, put everything in it, because all that will happen is a few years later, you'll just add a few more sheets and then apply again. So definitely. Someone said, that's my son. Helen, is that mum? Mum? No?
Yeah.
Mum, actual mum? No, okay.
No, actual mum,
Okay, but hello, good evening. And then, more fire emojis. Okay, awesome. Somebody asked, I can't see who now because the comments are moving so fast, but somebody said, how's the job situation in the UK after you've passed PLAB 2? So maybe speak a bit about that, and how actually you got your first job before even applying for internal medicine training.
Okay, so I think now there's been a lot of talk over how the job situation is in the UK here. When I got my GMC registration, and some of my classmates were already in the journey ahead of me. So I just got in touch with them and I just asked them how they went about the process. Like I said, I would have to ask so that I ensure that I'm going through the right process and not go take a detour and then come back to the same path again. So I think I asked one of my colleagues, one of my friend actually, he's really helped me settle in here in the UK since I came. So he sent me some job application links, vacancies in the NHS and also in the private sector, where I started applying. So I was shortlisted for an interview where I am, so the same interview where you'll be asked about clinical scenarios, why you want to be offered a job, your motivation and all of that. And by God's grace, I was shortlisted and given an offer, and then I moved in here to the UK. And now, when I moved to the UK, my main aim was to, like I said, get into training. So sometimes I tend to tell people that it's about what you really want to get in the long term. I wanted to get into training, so there are training and non-training jobs available before you're able to enter into training to become a specialist or a consultant. So, I mean, I applied for both NHS jobs and then and in private sector too. That's non-training jobs, trust grade jobs, SHO levels, where I was shortlisted and I've started working. So when I started working, that's when I planned to apply to enter into internal medicine training if given the opportunity. And by God's grace, I was shortlisted to be given an offer, and then I'll be starting it later this year.
Amazing. So you had your job before you even left the UK, before you even left Ghana. Sorry.
Yeah.
And did they ask for any specific experience, or how were you able to be successful in the application? Because that's not easy to do.
Yeah. So mostly right after once you complete your 2-year housemanship period in Ghana, so you have your permanent license. So it's more like you are done with your foundation training here. You can work independent. You can work independent as a doctor, not under supervision, but not under close supervision like how you were in foundation years. So most of the times, once you're done, you build your CV and try and put in all your clinical experiences that you've done during house job, because during house job in Ghana, you get to rotate through almost all the 4 main departments: surgery, child health, women's health, which is obstetric gynecology, and then internal medicine. So having this experience during house job and working as a medical officer, that means that you'll be able to apply for most of the job roles. Most of the job roles have certain criteria that if you can't meet it, you can't apply for it. Some are higher level CT1, some are like SHO, FY2 jobs that you can apply and get into the system, get adapted to it, and you can build it from there. So that's mainly what we used to do. I mean, recently there's been a lot of people applying for jobs, and it's a bit difficult to get into the system. But what I say is that we can't give up. We still have to continue doing it. If it's about building your portfolio and also improving your chances by doing something like clinical attachment when one comes to write the PLAB 2 exams, it helps to increase one's chances of getting a trust grade or non-trust grade jobs. And then get into the system, you have access to more opportunities and you build it from there.
Okay, amazing. So please make sure you send in your questions. Send in some more questions, because we've got Dr. AJ for about another 20 minutes. So make sure you send in all your questions. He'll be answering them live. I want to ask, what are the main differences, do you think, between working in the UK, working in Ghana? You also mentioned Germany. And do you think that, you see more of a future for yourself here? Do you think you want to go back? What's your experience been?
Well, working here in the UK and then in Ghana has been, I mean, it's a whole new experience for me, because in Ghana, it's more of like you are working in an environment where you have to prioritize patient safety, which is done everywhere, but sometimes the resources are limited and you still have to make do with the necessary resources that you need is to still see your patient. But I realized that when I came here in the UK, I mean, there was a patient like what we were seeing, and we had to order. The patient has some breathing problems. We have to order an advanced scan of the chest, like the CTPA, and then it was done in less than like an hour. I was actually taken aback, because it's like, I mean, it hardly happens. I couldn't see that in Ghana because of the cost involved. Some of the patients are unable to afford it back in Ghana. So it's like the healthcare system here obviously is more advanced than the one I was seeing back in Ghana. And I think it's more of like, I'm just grateful that I got the opportunity to practice here in the UK and having experienced both systems. In the long term, I hope to like advance in my medical career here, and then who knows, I might go to Ghana and establish a hospital and then give back to the community that made me become a doctor.
Amazing. So let's say one of your mentees, let's say one of the thousands of people who love you online, let's say one of them asks, okay, what would you advise me? Should I try and leave Ghana? Should I stay? Is it better to work in the UK? Because I know you've spoken about pros and cons, but what would you advise someone? What do you think is the better situation? Obviously, it depends, but
okay. So I mean, this question is a tricky one, because what I almost always tell people that I interact with is that it's an individual decision, but you have to get access to the information so that you get to decide. because sometimes people make decisions without getting to know what is really in it. So most of the people that I've interacted who have chosen to either do the PLAB exams or go outside of Ghana, I mean, I tend to tell them the options and let you know the pros and cons of moving here in the UK, and also the pros and cons of being in Ghana. Because I mean, I did my house job there, and also worked as a medical officer. So if I'm interacting with the person, I let you know the whole options. I get to let you know what is really in it, so that it's something that you get to decide, because the exams and all the cost involved, I mean, the journey is expensive, so you wouldn't want to start and stop halfway. Yeah, most of the time, I mean, on our WhatsApp platform that we have, the community of PLAB that we have, we almost tell people that, I mean, we can't give up, do you get it? Because once you're on, it means that you've already committed to it, that you want to get it done. And I think there's something we used to say when I was planning for it. A senior colleague told me that once you pass IELTS or OET, you're already a doctor in the UK. It's just a matter of time. I mean, because you need that proof of English proficiency exams to write it. So once you've spent money or invested money to pass the exams, that means you are really committed to finishing it. So I would encourage such a person. So most of the time, what I do is that once the person has already decided the PLAB pathway, that's when I come in, like with my friends who are already on the pathway, because we've already done it. So I can let you know this is how you can do to make it easy for you, so that you don't go and use a path that will make it very difficult. So I would say it's more like an individual decision, but in the end, you should know the options, what is really in it. Like where do you see yourself in, like in 5-6 years time? Is it something that you see yourself doing? Is it the system that you really want to be in? I mean, once you decide on such options, I'm sure everyone comes with his or her own decision, and then we take it from there.
Yeah, okay. I think that's really sound advice. Let's go to the comments. Someone said, show us the way. Wow, I'm super proud of you, AJ. So am I. Cindy, I'm also proud. Someone said, is the NHS really saturated as people say? I know colleagues who for about 2 years are still not getting jobs.
Well, I think the issue with job applications actually on the rise recently, because people are trying to get into the system. I mean, obviously, after passing your PLAB 2 and getting your GMC license, then the aim is to move get into the system, get a work experience, or if you want to get into a training role, you get it done. What I mostly tell people is that once the UK here can be a means to an end, or an end in itself. Someone can come into the UK, get the experience, and either move to the US and match into residency, or working a year in the UK, you're able to move in either to Australia or New Zealand without writing any exams, because the clinical experience that you get in the UK here counts for it, and you're able to register with their medical council, their work under supervision, and get your license there. So I think the NHS, even though it looks like it's saturated, there are other options. There's a private sector where you can also apply and get into the system, get the experience, and then if it's an end in itself for you, then you can apply for training roles or get into training as soon as possible, and then advance in your career like that. Yeah.
Awesome. Okay.
Yeah.
Someone said, at which level can a specialist in Ghana who has obtained GMC registration enter the NHS?
Well, from what I know, a specialist in Ghana can enter the GMC register, but it depends on the field. So let me take a specialist in, let's say, pediatrics or child health. And there is this advanced exam, which is the MRCPCH that people take, or for surgery, the MRCS. So those exams are available for such specialists to also take, and then they can enter the training role in NHS at a higher level than starting from scratch because I know some of my colleagues have also done the MRCS, I mean, which is an advanced exam than the PLAB. So just to clarify that the PLAB exam is just to get a license to practice in the UK. So once you get the PLAB exams done, then you can apply to work in the UK. But if a specialist, let's say in internal medicine or in child health, gets the MRCP or the MRCPCH respectively done, then such a person can enter at the specialist level, like from ST3 or ST4 level. Then that's like a specialty level. That person doesn't have to go through the PLAB route to just get a license. Yeah.
Yeah, definitely.
Okay.
And I think the other thing to note from what Dr. John has said is that even, for example, you, as you're doing internal medicine, you will end up doing MRCP at some point anyway. So if you are more senior and you're someone who can go straight into doing your Royal College exam, that's what MRCP stands for, member of the Royal College of Physicians, or like you said, child health or surgery. If you're at the stage where you can do that exam, then it does make sense to go ahead and do that if you're more senior and not bother doing the PLAB. I think the same person also asked, what training pathways exist for a specialist in Ghana? That's actually something I don't know.
Okay. I mean, so for Ghana, I think the Ghana College of Physicians and Surgeons is a main body that administers the training programs for almost all the fields. And then we also have the West Africa College of Physicians and Surgeons. They also administer residency programs for medical officers to enter into residency programs to become specialists and go on from there, subspecialized to become consultants after doing their fellowships and all of that. So I think the main body is the Ghana College of Physicians and Surgeons in Ghana. They are the ones who see over the training programs for all residents in Ghana.
So is it as structured as it is here, where it's, you know, the number of years, etc., you rotate, etc.? So
I think as far as I know, it depends on each specialty and the number of years that you are going to spend in it. So let's say for internal medicine, I know after 3 years you become a specialist. Then after working for a specialty, you can also, after working as a specialist, you can subspecialize into a specific specialty. Let's say the person wants to be a cardiologist, and that person will also do fellowship in cardiology and also become a consultant cardiologist. So it's more structured. So most of the specialization programs that I know of, internal medicine, pediatrics, surgery, and then obstetrics and gynecology, 3 years to become a specialist. Then from there, you have to subspecialize to do your fellowship program to be a consultant in that field. That's how it is.
Okay, so it sounds like it's very similar. More people calling you Moses. Someone said, whilst preparing for PLABs, does healthcare assistant role in the NHS also help some of the portfolio?
Well, I think working in the in such a role, you are in the hospital environment. And then you can that can count as an experience of you working in the system, because you get exposed to how the system works, because the whole hospital system is made up of the doctors, nurses, the lab scientists, healthcare workers, the nurses, and all of that. So we all make up the healthcare system unit in the hospital. So being in a role like this will expose you to how the structure works, and that can count as having exposure to the NHS, because sometimes some job roles just need you to have an exposure to how the NHS works. So being in a system like that in such a role can improve your chances of getting a job if you include that as part of your experience.
And for that person, I 100% agree. When I was in school, I worked as a healthcare assistant, like in the summer holidays when I was 16, 17. I think exactly as you said, it gives you insight into how the NHS runs, because it is a huge organization with very unique nuances about the system itself. So if you have knowledge of that before you apply, it just puts you in good stead. So I 100% agree with that answer. Someone said, statistics show that most UK doctors go to other countries like Australia for better salary and work-life balance. Non-dermatologists. Anyway, I learned some UK doctors even went on strike for increment in salary. Yes, we did. Any comments on that?
So like I said, that's why it means that it's an individual decision. Like, the UK can be a means to an end. So you come to the UK after working for some time, you get to build on your experience and all of that. Then you have the opportunity to apply to work in such countries like Australia and New Zealand. I mean, sometimes such decision that will come with having the family life, work-life balance, salary, of course, because I mean, money is also important. So people factor that in and overall come to the decision to either leave to such countries or remain here in the UK. Okay.
And someone asked, is there a way to get a job after doing PLAB 2 without any work experience? People are able to get jobs right after getting their GMC registration, because, like I said, so the platform that I formed with most of my classmates, some of my friends, after finishing the GMC exams, we decided to create a platform where we'll make the journey easier for most people. So like this, there are people who have done this before. There are some people who have come in straight from outside of the UK to come and start residency program here in the UK. So that means it's possible. People are doing it. So that means that on such platform that I have,
I mostly with some of my colleagues who have aced the exams and have their GMC license. Some are practicing here in the UK, some are also yet to come. We get to have sessions where we tell people how the whole system looks like. People are able to come in, apply, write the MSRA to get into some specialties. And you don't need to be in the UK to write the MSRA. You can apply to write for the MSRA in your home country and get to come here to start the training. I mean, coming here will be a bit challenging because it will be a whole new system and all of that. But with the determination and with the right mindset, you'll get it done. Yeah.
Love that. Okay. Someone, I think this was a continuation from the previous question, but specifically, would you also leave the UK for greener pastures at a point?
Well, at this point...
Be careful what you say, it's online.
Yeah, I mean, at this point, I'm starting training, so let's see how the future holds. Yeah, let's see how the training is going to go, and then I hope to complete my training, and then we'll decide from there. Yeah.
Good, very political answer. Very good. Someone said, bro, you're making me more than proud. Someone said, keep up the good work. Someone said, what did that say? Oh, I see you. Someone said, when I grow up, I want to be like you. Me too. I also want to be like Dr. AJ. Hi, AJ. You're doing a great job. AJ is the guy. Someone said, this guy taught me determination. That's
my roommate.
Your roommate. That's nice. Yeah. Hi, Roland. Thank you for being on. And then someone said, greater feats ahead, more grace to all on their journeys. Amazing. So we've only got a few minutes left, and I think maybe it'll be really nice for you to speak about your community.
Okay.
People like Roland, all these people that you've impacted. Tell me just about why do you do what you do? How come you help so many people?
Yeah. Okay, so personally, I'm passionate about medical education and also passionate about helping others in the medical career journey that we find ourselves in. Because the journey itself is arduous. So sometimes, if you don't have the right support or the right network, you might tend to give up along the way. So when I finished my PLAB 2 exams...
Someone said, AJ, are you married? That's why I'm smiling. Sorry, carry on. Don't let me interrupt you.
So, I mean, right after my PLAB 2 exams, my friends that I came to write the exams with, we decided to create a platform where we tend to help people. Because when we came to the UK to write the exams, we didn't have people ahead of us who actually taking us through it, because people probably have passed the exams, but you don't get to hear from them a lot. Some people are just naturally like that. They don't come out of their shells, which is okay. Like, but I felt that the journey can be made easier for people. The fact that it was difficult for us doesn't mean it should be difficult for others. And personally, other people helped me in my journey. So I was like, then we have to create a platform to ensure that it makes the journey easier for people who have already decided to be on it. So once people have decided to get their English exam done and book their PLAB, most people, they either text me or some other people that have been on the page before are still on the page, then they get added on. We have mainly like a PLAB community of PLAB 1 and PLAB 2. So the PLAB 1 is mainly for the MCQ aspect of the exams, where we get to share concepts, discuss, we take people through the timelines of the exams, because sometimes you have to know the timelines of when to do your exam so that you're able to achieve certain targets, because now PLAB 1 dates are so difficult to come by, and it's important that when you book it, you pass it right there and then. So we want to ensure that people are passing it there and then, so that they're not wasting their hard-earned money to book it again and all of that. So that's mainly for the PLAB 1. And for the PLAB 2, which is more of like the intensive part of the group, because that's where the PLAB 2 is in such a way that it's different from our clinical practice that we used to have in Ghana, a little bit different, because over here, how the consultation and all of that is a bit different. So you have to adapt to the culture, the work environment, and whilst prioritizing patient safety with the patient in front of you. So it's important that someone who has passed the exams is able to tell you that, oh, with this case, I think you should say it this way. Then you practice. Then the person listens in. So we mostly hold group sessions every day of the year, every day. And without...
So how many people are in the community?
We should be more than 400 plus, 400 plus.
And you just started this within the past year or so?
Yeah, past year or so,
That's
we're
incredible.
Almost getting to like a year and a half now,
people. That's really amazing.
And so mostly my colleagues, my friends who have passed the PLAB exams, they are really integral to making the group work, because I can't do it alone. There are most times I'll be busy. So some of my friends who are also GMC registered, working here in the UK. Some also in Ghana, about to come in. They join in the sessions to help those who have booked their PLAB 2, so that as they are learning, because sometimes it's difficult to unlearn some things that are not right. So we want to ensure that right from the first day, you are learning the right things from someone who has passed the exam. So let's say the person just passed his or her exam recently, and such a person is telling you that this case, I think you should go about it this way. It will help you. There's a new scenario, go about it this way. It helps you keep in line with current trends in current scenarios, and you're able to like really be efficient in your learning. So, and sometimes we'll hold sessions where people who have passed the exams come in. Our FY2, we call it a give back session. They come in and just tell us how their whole exam experience over the whole scenario. Because like passing the exam is a whole different thing than it's a whole different feeling. So everybody will relate with it differently. So it's important that people who pass the exams, because of how they know the group has helped them, they are always available. Because sometimes someone is unavailable because of a shift, and I just need to let's text somebody, or can you just come in this session, so that the candidates can have their sessions and learn well. And such they always avail themselves to help. So it makes it very very nice and involving. It makes it like a community of everyone helping each other, because it's very easy and it's not so demanding. Because sometimes an FY2 just have to join just like once a month. So it's not like every day, because we have a lot of people who have passed the exams. I mean, by God, we have a lot of people who have passed the exams. So we have FY2s or like GMC licensed doctors who are supervising their group sessions, because the PLAB 2 is a very demanding exams and involves, like I said, the timelines. You have to know when to apply for your visa, when to get the accommodation. We have a session where we take them through everything and get it done. And then after that, how to apply for your GMC registration. Because sometimes people apply and then they have some difficulties. And I tell people that, I mean, the difficulties you're having, someone has gone through it and we solved it. So we just say it so that it makes it easy. You get it done, and then the journey becomes easy and makes it less difficult than it already is. Yeah, so that's basically what the PLAB journey community has been so far. Yeah.
Congratulations.
Yeah, thank you.
And very well done. I feel that nobody heard anything you said, because everybody just wants to know if you are married. But I hope you guys were listening, because he gave a lot of gems. But yeah, everybody's asking. I'm interested in the marriage question.
No,
please, can you answer? AJ just smiled at the marriage question, swerved the question. He didn't swerve the question, guys. He was talking. So, do you want to answer the question?
I'm not married.
He's not married. You've heard it here on House of Medics. If you're interested, you pass your inquiries through me. I'm now the designated big sister, so you can pass it through me, and I'll let you know if you will consider. Someone said, have you formed another group to help other people who want to start their journey? And then can we have details of that group? So yeah, give people details of the group, and then we'll round up from there. Yeah, so it's basically, we have the groups on WhatsApp and on Telegram. Yes, WhatsApp is just a PLAB community, so I think I will probably send a link on the page when we are done with it. Yes, it's basically a PLAB community, so we just add you on it. We have the sessions, and basically I want to ensure that the group is in such a way that it's people who have booked the exam. So before you are added, you have to let us know that you've booked your exams. Like you have your PLAB 1 book, PLAB 2 book, so that everybody's focused. Yeah, exactly. Yeah, so that there's no distractions. Yeah, and sometimes the unfortunate part of that, some of our colleagues are not able to make it, but we don't just leave them. We get to meet them separately, get to know what went wrong, and then they're able to go again and get it done, because they can't just end halfway. We have to ensure that they are finishing their whole journey and then getting their license. Yeah. Amazing. Okay. Yeah. Well, Doc, I really enjoyed that. Yeah. I think you're doing amazing. So thank you for all the great work you're doing for the community. Let people know where they can find you. Are you on socials? How people can find you online? Okay, so on Instagram, I'm AJ_Gyasi. Yeah, AJ_GYASI. Yeah. On the same on Twitter, AJ Gyasi, yeah, that's it. So can people message you to ask about your PLAB group and how to get involved? Yeah. Amazing. So thank you all for joining. This has been one of the most fun streams ever, actually. So I hope you enjoyed it. For those who want to know more about the House of Medics, head to our website. All the information is there. That's www.houseofmedics.org. Our handles on Instagram and Twitter are @WeAreHouseOfMedics. We're on LinkedIn, House of Medics, and we're also on Twitter, House of Medics. Someone said, can you please send the link on the House of Medics group? For sure. So those of you who are in the House of Medics Telegram group, we will share it in there. Keep up to date with everything we're up to in the House of Medics. If you want to connect with me, I create a lot of skincare and dermatology content. My ats on Instagram and TikTok are derm.emma. That's DERMDREMMA. And stay tuned for, I'm just looking at the comments. Yeah, everyone is saying God bless you. We have been House of Medics today. Stay tuned for our next live stream. Make sure you're checking us out on YouTube. I didn't even say YouTube. YouTube, House of Medics, that's probably our biggest platform. So make sure you meet us there. Stay up to date with everything we have up to. Make sure you sign up to our mailing list as well, because we have lots of different events and opportunities that get sent out every month. And you can also sign up to our mentorship scheme, which is actually how I know John. So you can sign up to our mentorship scheme. It's all on the website. Thank you all for joining. Nana says this was really helpful. Someone said, AJ, you spoiled there. He did spoil everything. Someone said he's a popular guy back in Ghana. I know, because guys, if I come on live, I don't get these kind of comments. So I even feel a bit jealous that, I'm meant to be the host, but he's more famous than me. So yeah, thank you all. Thank you all for joining. And make sure you catch up and stay up to date with everything House of Medics is up to.
Thank you.